Welcome to the Snapscale Show, hosted by Mike Yablonowitz and Nathan Bush. In every episode, we explore the real challenges and breakthroughs happening in modern healthcare operations, from navigating compliance to virtual staffing and emerging technology. You will hear real stories from clinics, learn from healthcare leaders, and uncover practical strategies that help you run a smoother, more efficient practice, without losing focus on what matters most: patient care. Snapscale exists to take the pressure off your front office and administration work, so you can get back to doing what you love. Be sure to subscribe to our YouTube channel to get the latest episodes, and visit snapscale.com to learn more. Let's simplify healthcare operations together. This is the Snapscale Show.
Welcome back. And today's guest has spent more than 2 decades helping employers take back control of one of their biggest expenses. Healthcare. Jentry Harris is an employee benefits consultant at the Mahoney Group, where he helps mid-size and large employers transition from fully insured to self-funded. Now, this reduces the risk, and it also helps improve employee care and patient care. He's spoken on nationally designing plans, medical management, and healthcare fiduciary strategies. And his mission is simple. It's to build a plan that serves employees and families, not just insurance company profits. He has the letters to back up his name, too. That's why we have him on the show. He's a registered employees benefits consultant at REBC. He's a tribal human resources professional, THRP, Health Rosetta Associate Advisor, and an HFCP. I'd like to welcome to the show Jentry. What's up, Jentry? How are you?
Great. Thank you, Nathan. Happy to be here. Thanks for having me.
Yeah, super excited to have this conversation because healthcare and insurance, it's its own thing. A lot of healthcare practices take insurance, but not a lot of them are really thinking about their health insurance and their premiums and all that kind of stuff. And so I wanted to bring a show together that can help streamline some of these financial costs. But before we get into that, how did you get into benefits specifically?
Yeah, great question. So in the industry, I often say people fall into the insurance industry. But for me, it's actually my older brother, who's 2 years older than me, thought I'd do a good job at it. And here I am 23 years later, still in it. So
that's incredible. When did you realize the system was broken, Jentry?
You know, I think for most brokers, they kind of get into this business and it takes a little while. And some of them probably never realize, that it's broken. They probably realize it's broken, but they don't want to realize it because it's a very lucrative industry. It's I think when it comes to GDP, it's like probably one of the top things. 25% of GDP is healthcare. And so for me, I realized probably about halfway through my career and just saw these increases out of control and thought, you know what? I don't want to wake up at the end of my career and say, hey, I sold all of these great, insurance company plans and didn't really help anybody. And so that's when I kind of started looking and trying to discover other options for employers out there.
Yeah, that makes total sense. So why is employer healthcare for healthcare practices so expensive? Like, where does the money go?
Yeah, so I'm not a conspiracy theorist, but anybody who has health insurance, we all can agree that it's a broken system, and there are fixes to it, regardless of what the government says or lobbyists say. It's actually the highest lobbied industry in our country. You can go check the statistics; they're ever changing, but it's hundreds of millions of dollars that are pumped into lobbying for healthcare, whether it be insurance companies, pharmacy benefit managers, and so on and so forth. So follow the dollar, and you'll realize why it's so expensive is people want to get paid.
Yeah. Why do you think the costs keep going up and up and up every single year? It's incredible to me to watch health insurance premiums rise. I mean, just this past week, I had one of the clinics we were working with talking to me about how expensive their health premiums have gotten.
Yeah, I think there are a number of reasons. Obviously, the reason that we're given isn't the true reason. I think the true reason is the system is built to benefit the insurance companies at the end of the day, not the patient. And so all the way through, there's a lot of fraud, waste, and abuse. One of the books that I share with employers when I meet with them is a book called The CEO's Guide to Restoring the American Dream, written by a gentleman named Dave Chase. He's the founder of Health Rosetta. And in the book, he talks about all of the different ways that insurance companies and pharmacy benefit managers and brokers like me, or not like me, how they make money.
Yeah, I mean, it's wild how much hidden costs live inside of systems that we just accept every single day, And we see the same thing on the operational staffing side with Snapscale. Practices think it's just normal overhead to add another person, but there's really a lot of leakage there that are inside businesses that could be filled with virtual assistants. I'm sure there's a lot of leakage that you see that's going on inside of their health insurance.
For sure, probably the biggest robber of profits to a health plan is the pharmacy right now. It's the fastest growing piece of healthcare right now. They're getting a lot of scrutiny. In fact, last week there was a new bill under the Consolidated Appropriations Act that was signed specific to pharmacy benefit managers, transparent pricing, spread pricing, meaning they mark it up, right? You've heard of Mark Cuban and cost plus drugs, getting away from that type of model. And so there are lots of changes. I've probably seen more change in the last 5 years than the last 20 years being in the industry.
Yeah. So then let's fast forward to what you specifically are an expert in, and that is self-funding. What is a self-funded plan, or what is self-funding in plain English? It seems like it's complicated, but I'm sure that there's a simple explanation.
Yeah, it isn't as complicated as I think most people make it to be. And in the past, there were some problems with self-funding, but a lot of those problems don't exist anymore because of legislation, but also just the stop-loss carriers that are in the market underwriting things much better than they had in the past, and really having the actuaries that know the way that claims perform, employers perform. So I always like to explain it very simply, Nathan, is a self-funded plan is no different than a fully insured plan. You just have more transparency, and there are components to a fully insured plan that exist on a self-funded plan. The main difference between the two is that an employer has a say in how their health plan is structured. They get the data that they need to make decisions, just like they do in every other aspect of their business. And so just to break it down very simply, you have an administrator on a fully insured plan. That's going to be one of your major four carriers. We all know who they are, right? With a self-funded plan, you have what's called a third-party administrator. And think of them as kind of the quarterback to the plan. They are the ones that are picking up the phone for customer service, printing ID cards for all of the members on the plan, adjudicating claims as they come in from providers, orchestrating the network, right, of doctors that are contracted under the plan, coordinating with the pharmacy benefit manager, and then most importantly, where the risk lies, is working with the stop-loss carrier. And so all of those different components that I just rushed through really quickly are what compose a self-funded plan. And it's no different on a fully insured plan. You have all of those same components as part of a health insurance plan with medical and prescription benefits.
Sure. So who qualifies for these self-funded plans? Is that any healthcare organization that is, watching on replay? Like, what is who qualifies?
Yeah, great question. So I will say that employers that have 100 or more enrolled employees in their health plan, there's a lot more options available for them. There are hybrid self-funded plans called level funded plans that even the major insurance carriers have available. But typically, it's not based on industry. It's based on more the number of enrolled. There are industries that perform better than the other industries. Physical therapy networks perform very well. Construction is another very good performer in self-funded plans because you have younger males that are working, right? We have trucking companies, we have waste management companies, manufacturers. the ones that typically pay more on a self-funded plan are, lawyers and doctors, believe it or not, because they know how to work the system typically, and they're high utilizers. And then the other piece is, believe it or not, older females that utilize the plan a lot, typically have higher claims than those other industries that I mentioned earlier.
Yeah, interesting. So I'm sure that there's some big myths that have been floating around out there about these self-funded plans. And because personally, before I met you, I wasn't very much aware about self-funded plans at all. And so you opened my eyes to a whole new opportunity for people to get their costs in line inside their business. What are some of these big myths that really you hear on calls or when you're talking with clinics that they just believe to be true that are no longer true?
Yeah, I think the biggest myth is that it's a huge risk. There's a huge risk to me, and that's not the case. There is risk, but there's also significant reward. Actuarially, on a self-funded plan, you're going to have 2 average years, 2 good years, and 1 bad year. And so the whole philosophy is, if I can save money during the good years and on the average years break even, I'm going to be ready for that 1 bad year that statistically is going to come up. So that's one myth. Another myth is that with a self-funded plan, I don't have any control. And that's the complete opposite. You have complete flexibility. You have data that you're now getting all the way down to the member of, who went to the hospital, when they went, why they went. So that's another big myth when it comes to self-funding. Another big myth when it comes to self-funding is it's complicated and difficult. And that's not the case either. As long as you have a third-party administrator that is administering the plan, taking care of compliance, filing the stop-loss claims that come up. I'm not going to lie, there is a little bit more work and involvement, but don't you want to have more involvement and engagement than just handing it off to an insurance company and allowing them to increase your rates each year? So that's a myth, but it's not as difficult as you would think. And people think that, self-funding, it's this very difficult, complicated thing. And it really isn't. It's just breaking apart the different pieces within your current health plan and having a say in how those different parts function and work together.
Yeah, Jentry, do you ever see, like, inside these businesses that you're talking to, this just came to mind with me, these operational efficiencies like admin overload or staffing chaos that are actually driving up their costs of healthcare, meaning they may have too many staff members for what they really need?
I typically see more the opposite of that, Nathan, where you have an HR manager, especially on groups, that have maybe 100 to 500 employees. It's funny. I picked up a client last year, and they have one gal for a group of 450 employees. She's not only handling the employee benefits, but she's handling payroll. She's handling quality. She's handling compliance. Her husband happens to be an attorney. She's handling legal aspects. So in the niche that I work in, anywhere from 100 to 1,000 employees, I actually see kind of the opposite, where it's understaffed for the job that is required when it comes to employee benefits. I think that people maybe underestimate the amount of involvement and work that there is with a self-funded plan. And so I don't know if that answers your question or not, but that's what I see typically.
No, it's an incredible thought to even think that there's an understaffing that's going on inside of some of the HR aspects of business, because people they're afraid to bring on additional staff members because of the expense that's associated with those people. So they're trying to run leaner, but there's still work to be done. And so at Snapscale, we talk about a lot of times people, processes, and platforms, right? They're for every single platform that's going on, whether that's your payroll platform, whether that's your EMR system, there has to be a process in place to manage that system. And then there have to be people that support the processes that are in place. It doesn't matter how much automation you put in place or try to put in place. There is still a people component to business, no matter I know the horror stories of people thinking that AI is taking over the planet and that we're all going to lose our jobs. And that may be in 25, 30 years. I don't know. I'm not predicting the future here. But what I am saying is that today, the word calculator of generative AI or the workflow processes of adaptive AI, they're still not replacing the people that it takes in order to do the roles. And so from my perspective, why pay all the health benefits, the additional cost of the employee, and all these things for the administrative side of things when you literally could just add a couple of virtual assistants to your HR team to process some of the stuff that needs to be done? And you're not paying nearly the same price you would for even one full-time person. So I think you answered my question in a roundabout way, because the real problem that businesses are running into is they're either A, paying way too much for staff, and they've hired way too many people, and now they're looking to cut people as we go into 2026, which is terrible. Nobody wants to lose their job from a business they've been giving their life to. Or the other side is like you're saying, what you've been seeing, where they're completely understaffed. And they don't have the resources, not just to keep up with, a self-funded plan. There's not a lot of extra work that goes into that. We just talked about it. It's very similar to administering just regular insurance company. There's a little bit more hand-holding between you and the process, but you're not adding staff for that. You have somebody doing insurance, but then you don't have people that are processing payroll. You don't have people that are and so that is a major problem, is that you got to make sure that you're not burning your current people out with understaffing, the team member. And then now you got an issue in your business because people are turning over and they're leaving your organization. Is turnover complicated in a self-funded plan?
It isn't that complicated. I mean, the only thing that really comes into play, two things to note on that, Nathan, is first of all, with turnover, obviously you're going to have more processing of terminations with the third-party administrator. And then obviously, for those individuals that are terminated, if they do elect COBRA, they can stay on the plan by law, right, up to 18 months. So it's standard on a self-funded plan versus a fully insured plan. So if that individual got onto the plan specifically for health benefits because they have some medical issues, they can drag on and stay on that plan up to 18 months, which could be detrimental to the plan. But that's going to be regardless if it's a self-funded or a fully insured plan. So,
yeah. And we were talking a little bit about the California client that you had that saw a 30% increase in their premiums. Walk me through that. Help my audience here understand what happened and why that went on.
Yeah, so I was referred to an individual in California, another PT network in California, from Tim Spooner, who's a client of mine here in Arizona. And they were facing a 30% increase from one of the BUCAs, right? Blue Cross, United, Cigna, Aetna. And very, very business savvy business owner said, I've got a relationship with my current broker, but I'm intrigued by this self-funded thing. And Tim's been telling me about it for years. And so we provided them with an analysis, and we were able to come in with a TPA and a network that was very comparable to what they were doing. We didn't change any of their benefits, kept them the same. And after the first year, their loss ratio, right, what they predicted or estimated to pay versus what they actually paid was around 80% on just the claims amount, not the fixed costs, administrative costs. And so what that allowed them to do going into the second year was they were able to waive all the copays on their prescription drug generics. So on their plan, none of their employees for generics now pay any copay. The second thing they were able to do is they were able to reduce their deductibles, both for individuals and for families, by about $500 a piece. So they have 3 plans that they were offering, and they were able to reduce those deductibles down for the employees. And then the third thing was they didn't have to increase their deductions going into the new year. So huge win for them. They're now in their 4th year They just went through their January 1st renewal. They're now in their 4th year. They've added some additional benefits, including a benefit that's free if they go through a third-party cash pay program that's built into their plan. The employees have no cost. So prescription, or
Really?
sorry, lab and X-ray, their scans, their like MRIs, CT scans. So within their plan, their self-funded plan, they have a vendor that goes and sets up direct contracts on a cash pay basis. And if their employees choose, right, it's voluntary, their employees choose to use that benefit through that vendor, they have no out-of-pocket costs. So those are the types of creative things that you can do in a self-funded plan that make all the difference. Now, people ask me all the time, it's great that they don't have to pay anything, but where are you referring these individuals to? Are you sending them to Mexico or, some poor provider? No, that's absolutely not the case. We look at local providers within their area. This group is located in Visalia, California. And we look at providers and we use HEDIS as well as Medicare ratings for quality in order to determine what providers we're going to go out to and set up cash pay programs. So it's really kind of a tailored solution, and it's on elective procedures, right? We can't plan a heart attack and a cash pay on a heart attack at a hospital facility, but there are other things that we can do in those situations that we can talk about more when it comes to those high cost claimants that drive about 80% of the spend on any self-funded plan and on a fully insured plan as well.
Yeah, it's amazing how often savings aren't just about working harder. It's about redesigning the system, right? And finding the right resources in the right time. We do the same thing, though, when practices clean up their workflows and staffing. It's like margin just appears for them. It's amazing when you do the right things inside of your business, how much is actually there. I mean, you spend your whole life as a doctor going to school, working hard to get good grades so that you can open your practice and do all this work. And then we find that these practices, they're burdened with understanding insurance benefits. How do I do my taxes? How do I make sure that I can market and bring in patients that I can service? How do I staff myself properly? These are all major questions that they have that they just don't get a lot of answers to. And that's one of the reasons why we do this show for you guys, is because whether you're in physical therapy, direct primary care, audiology, ophthalmology, or any number of the ologies that we specifically support, it's Snapscale and the audience that watches our show. Like, you guys, you're the ones that make up America. You're the ones that keep us healthy. And so we just want to find different ways to help you and support you in growing your business. And if that resonates with you, I totally appreciate it. If you guys could head over to snapscale.com and set up an opportunity to meet with one of our team members there. So now, enough with a shameless plug. I'll get back to Jentry here. Jentry, I have to ask you, what beliefs does the industry get wrong? Meaning, with staffing, one of the beliefs that people have is that when I use an overseas person, the accent is going to deter my patients, right? That's a big belief that people have, that they have to just get past when they're using outsourced staff. The same way as if you were hiring somebody in the US that had a Hispanic accent, right? Patients are going to come familiar with the people that are calling them, that are talking to them, that are doing the work with them. And they're going to schedule, they're going to book with you, they're going to follow through just as normal, as long as you don't treat it like it's something weird. Right? You just go about your normal business and you add staff members through Snapscale. What are some of those things that the industry just gets wrong?
Yeah. So first of all, I think to quote a direct primary care doctor that I met years ago at a conference, his name is Jeff Gold. He's out of Boston. We're addicted to a system, a broken system. And the problem is that we all just go along with it, right? We don't question doctors and tests that they, request on our behalf. We don't question insurance companies and, what we're allowed to do and what we're not allowed to do. We don't question employers, right? And say, hey, is this the best healthcare that we can get? What's the relationship with our broker? And you're seeing this a lot with the Consolidated Appropriations Act right now, Nathan. People are starting to question their employers, just like they did when the Pension Protection Act came out regarding people's retirement plans. The same thing's happening right now, and we're right at the very beginning of this. And so just asking questions about healthcare. We talk about these consumer-driven health plans, CDHP, HSA qualified plans. Everybody, thinks, yeah, they're great for the tax benefit. But one of the problems that we didn't realize was that people, especially, laborers, they're not going to go get care if they can't afford it. They're going to buy their groceries before they go get the care that they need for their family. And so that's another misconception in our industry is, people really understanding. Most Americans, I think the statistic is like 80% don't know what a deductible is, what a copay is, what a coinsurance is. And so they're given these plans. And I remember I was thinking about this going into this podcast. I remember when I worked for Target Financial Corporation, I got my employee benefits pack, and it was about that thick. And my brother, who was in the industry at the time, I went to him. I didn't understand what the heck it was and what to pick, right? And so it's helping employees understand that there are better ways to access healthcare, and employers getting outside of this box of, I have to go with a major brand and I have to go with a major broker. And that's simply not the case. There are lots of independent third-party administrators out there that do excellent work. You can have the same doctors. You're not going to lose your doctor, right? You're going to have a network that's comprehensive. And then for those employers that want to take the next step, they'll just go and do direct contracts with the providers, both facilities and specialists. So there's lots and lots of flexibility. I call it the sleeping giant. The employers are the sleeping giant, to quote, Marshall Allen, who passed away, wrote a book called The Price We Pay. Employers have a lot more power than they know that they do. They just have to look more and dig a little bit deeper, just like they do in every other aspect of their business. Don't allow insurance companies can control your health care. You be engaged and take a role in providing better benefits for your employees.
Yeah, so it sounds like a perfect solution. Why are brokers so resistant against self-funding? Not, I know you're not, but why are other brokers against self-funded plans?
Well, I think it's changing, to be honest with you, Nathan. I think there's a lot of money in the insurance industry, and there are incentive trips, there are kickbacks. And so a lot of the transparency is coming out with the Consolidated Appropriations Act. So to be honest with you, I think a lot of it comes down to the dollar. But I think that some are also hesitant because it's something new. It is more work as a broker or as a consultant to put together and manage a self-funded plan. I'll just be honest with you. It's way easier to install a BUCA plan and set it and forget it, and then at the end of the year when it comes up for renewal, all right, let's go out to the market and let's quote all of the different carriers and let's do our typical dog and pony song and dance with the carriers, and we're going to negotiate it from 30% to 15%. We did our job and off to the races. Here we go. And so I think
really
they're
benefiting them.
What's that?
Go ahead. You think there's a number of what?
It's really benefiting. It benefits the agencies that they work with, the publicly traded, but also benefits the insurance companies.
Yeah. And who benefits when these healthcare employers stay confused and they don't know what to do? Who's the one benefiting there? Yeah.
It's again, I'm not a conspiracy theorist, but it doesn't take a rocket scientist to see, there are some significant problems, and most of it comes down to the dollar and what people make. And probably 7-8 years ago, 5 major companies, JP Morgan Chase, Amazon, I don't remember the others, but they basically said, we're going to create our own health plan. And within a year and a half, 2 years, it failed because they didn't want to impede on the money that was conflicting with other businesses that they owned. And so that just shows how strong and gridlocked the system is.
Yeah. I mean, that theme shows up everywhere in healthcare. Complexity typically benefits the vendors, while simplicity typically benefits the owners. And so if we can help them understand the simplicity and some of the things that it is that they can be doing, then they can win. And it only takes a couple of small adjustments. I mean, think about this. If you're headed towards England and start your path and you're just a couple degrees off, you can end up in Africa. right? So if you can learn what that path is right up front as you're growing and scaling your organization, and now you're at 50, 100, 200 employees, and then you can start thinking about what to do next. So if somebody has grown to that size, Jentry, they're at, 50, 100, 200 employees, what should they do, tomorrow when they wake up, they've listened to this podcast? What is the first things that they should do when it comes to this whole thought process around self-funding?
Yeah, if you have a relationship with your advisor, ask them about self-funding. Say, tell me about self-funding. Why hasn't this been shown to me before? And most employers and business owners are pretty savvy. Going back to that example in California, it was very clear very quickly to this business owner that the broker advisor that he was working with didn't have any self-funded business and didn't know what they were doing when it came to self-funding. And so they couldn't speak to it. Even their website, he told me, Jentry, look at their website. They don't have anything about self-funding on their website. It's just, they're going and just quoting the standard market and not showing me all the options. And so I would really encourage, practice owners to say, hey, I've got to look at this as a potential strategy. Typically, it's the second or highest line item in their P&L is health insurance. It's extremely costly. And so finding ways to manage that in a more prudent manner. And regardless if you're fully insured or you're self-funded, because of the Consolidated Appropriations Act, you have a fiduciary obligation to look at all of the different options and make the best decision for your organization. So,
perfect. So 3 questions. Break it down into practical. They're going to go to their broker. They're going to ask these 3 questions, but they can only ask 3 questions. What 3 questions should they ask?
First question would be, why haven't I seen a self-funded option? Second question is, how many self-funded employers do you work with? And of the self-funded employers, how many are with an independent TPA? Not a Wall Street-owned insurance company. They call it administrative services only, but an independent TPA that has your best interest, not the interest of the profits of their shareholders and stock. So those are the 3 questions.
And then those brokers are going to answer them. I'm trying to keep this simple for everybody. What are the red flags they should be looking out for?
Self-funding wouldn't be a good option for you. You're too small, or you have sick people that are on your plan, right? So those may be some of the responses. Or we'll just move you over to this insurance self-funded plan, which we call it fake self-funding, because there are different profit tiers with an insurance company. Make no doubt, the most money that insurance companies make is off of a fully insured plan. The next is a level funded plan. The last is a administrative services self-funded plan. And so those insurance companies, they don't want to lose money. And the insurance brokers, they don't want to lose money from the contingencies of being on that fat, fully insured plan. So it's just asking and being persistent and telling them, if they say, well, this isn't good for you, say, I don't accept that. 64% of our country is on a self-funded plan. 64%. So why am I not being shown the option of a self-funded program if so many employees of the American public use a self-funded program?
Yeah. It sounds like whether it's benefits or staffing or operations, the leaders who win are the ones who stop accepting the defaults, the standard, the way things are going, and start designing their practices intentionally. This ties exactly to Snapscale's philosophy. It ties exactly to what we believe, and that is that you've got to find these areas in your business, guys, that you haven't been focused on and be intentional about them as we go into 2026. And so, Jentry, who should reach out to you, if they should at all, and where can they connect with you?
Yeah, so thank you, Nathan. Anyone can reach out to me, including employees, because employees have a voice, right, in the decision of their employee benefits. But primarily, I work with business owners, practice leaders, CFOs, HR directors. Those are the main individuals that I work with. And the easiest way to reach out to me is through my LinkedIn. Just DM me, and we can go from there and look at what options may make sense for you. And if you're currently self-funded and you're happy with your program, I'd love to still try. And if you're doing everything that I would do, keep doing it. But the majority are not, and the majority should give me a call. I'd love to talk with you and try to help you figure out better solutions for your employees.
Awesome. And where can they connect with you at?
So my email is just jdharris@mahoneygroup.com, and my cell phone is 480-518-3942. And then my LinkedIn is just at Jentry Harris through LinkedIn.
Awesome. You guys should definitely get in contact. And thank very much, Jentry, for being a part of the show today. Incredible guest. There's so much that everybody could learn from the information you had to share. And so I totally appreciate you being a part for our audience.
Thank you so much, Nathan. Appreciate it.
You're welcome. All right. So here's the deal. Like, if you're an employer listening to this, healthcare costs aren't fixed. They're designed. And if you redesign them, you can win. We work with a lot of practices on operations and the staffing side at Snapscale. And it's interesting, when they fix benefits and they fix their operations together, their profitability spikes instantly. So if you want more information about Snapscale, you can head directly over to www.snapscale.com. That's www.snapscale.com. And set up a meeting with an advisor. We'd love to walk you through that process. We'd love to talk to you about what we do at Snapscale and how we can help you with HIPAA-compliant healthcare virtual assistants for your healthcare practice. Now, when I say we're HIPAA-compliant, I'm trying to help you understand that we do things differently than other virtual assistant companies do. Number one, you're going to sign a BAA directly with your organization. So that and first and foremost, a US-based company signing a BAA with you, that's very different than anybody else. Number two, second thing we do at Snapscale that's very, very different is that all of our team members are going to be HIPAA certified, meaning they're going to go through the HIPAAtraining.com class and get their certificate before they start. There's 17 different things that I could send you a list if you need to show or demonstrate what we go through in order to ensure that we're HIPAA compliant, because we used a consulting agency to set up our HIPAA compliance, third-party audited. They're the ones that do our annual audit of our HIPAA every single year. And after our last audit, this is what our consultant had to say about our practice. And this is how we'll close out the show today.
Mike is an interesting example. Mr. Yablonowitz and Snapscale, previously Brobisco, or BBC Global. We don't know, HIPAA training doesn't do webinars. We don't partner with clients and help them market. My purpose of being here is not for marketing. I'm not interested in generating sales from web contacts. What I am interested in is taking information that shows up regularly and becomes problematic regularly for our clients, so that you know you're conversant and know how to ask questions and know what the answer should sound like. Mike is an obsessive when it comes to compliance. The way he approached compliance when he became our customer 3 years ago was, yeah, but how do we do better? But I know what the minimums are, but you know, I've got some clients that are concerned about VAs, and what do we do to bolster, you know, Matt, honestly, how do we show up as the best in the market? And it was a year, maybe a year and a half working together on a system that didn't exist. It doesn't exist anywhere. I can tell you, we have dozens of virtual assistant platforms that work through HIPAAtraining.com, and there are probably 100 more that work through other of our peers in the industry. And the reason Snapscale is the only organization that we will do this with is because they exceeded the minimum standards. Then they exceeded what were considered exceptional standards. And then they started creating their own standards that are so far and above, they're so beyond the pale that it's going to generate a new standard in what is considered remote virtual healthcare.